Okay, let's look at this question. So we got this 6-year-old boy brought to a pediatrician because he's got recurrent infections, and mom is seeing these painful red rashes on his skin that are like itchy, and multiple episodes of pneumonia requiring antibiotics, and abscesses are swollen but not tender, and he's got this red stuff since infancy. The child is not having a fever, diffuse erythematous scaly stuff on his trunk and upper extremities, and nasal bridge, prominent forehead, deep set eyes. Cool beans, a lot of stuff here. And they even tell us IgE is elevated. Let's just look here. Which of these best describes this pattern? So you know the IgE is elevated. Good job. So you're probably thinking the answer is D. All right, but let's talk about the syndrome, okay? Because you'd be right that it is D. But hyper IgE syndrome, also known as Job's syndrome, is an immunodeficiency order that's caused by the Th17 cell differentiation due to a mutation in the STAT3 gene. And so this cause is impaired neutrophil chemotaxis, which leads to recurrent infections, eczema, and distinctive facial and skeletal abnormalities. IgE is going to be, all these things make you think of E, right, with that type 1 hypersensitivity-esque kind of symptoms. And there's this interesting thing called a cold abscesses. And so let's talk about that. But before we do, let's talk about IL-17s. Okay, so 17 is a critical cytokine that's released by Th17 cells. And IL-17's main function is to recruit the neutrophils so that they can promote infection at the infection sites. And in hyper IgE, the STAT3 mutation leads to decreased production of Th17, decreased IL-17. Neutrophils then fail to properly migrate to the infection sites, and so you can't mount an effective inflammatory response. The neutrophils aren't there, right? And so the abscesses become cold, or they become non-tender because there are fewer neutrophils. And that's what causes the teeth to grow there and see that weird, the teeth findings in all these patients. So neutrophils don't migrate. So then you can get some non-inflammatory infections like Candida, Staph A, and the typical abscesses are red, hot, painful because of the pus, the inflammation. But here you have no such thing. Chronic atopic dermatitis like eczema, IgE levels lead to mast cell degeneration and the release of histamines that causes those. Skin colonizations with Staph A and Candida triggers the excessive immune activations. All right, so those infections will cause it to become even worse. Impaired neutrophil function, decreased IL-17, prevents the clearance of bacterial and fungal pathogens as well. And so some other organisms you can get recurrent sinopulmonary infections like Staph A, Candida, and Aspergillus as well. And the facial dysmorphic stuff, like this stuff, the nasal, prominent forehead, deep set eyes, the STAT3 also affects bone development, and that's why you see those features. Retained teeth, well, STAT3 impairs the osteoclast functions. Those normally reabsorb the bone and allow the primary teeth to just fall out. But STAT3, you can't have functional osteoclasts, and so you can't take them out. They don't fall out like that. So elevated IgE and eosinophilia, the exact reason is unknown, but the failure of Th17 cells to regulate leads to hyper IgE production. So now we know. It's all about the STAT3, Th17, macrophage stimulation, linked somehow with IgE levels, eosinophilia, symptoms related to type 1, hypersensitivity reactions, that kind of stuff, dental intervention. It's all about hyper IgE and Job syndrome. So if this is helpful, like and subscribe. Love to get to 100 subscribers.